Let us discuss about cancer chemotherapy complications. The first complication is mucositis. The chemotherapeutic drugs which are associated with mucositis are antimetabolites such as methotrexate and 5-fluorouracil, anti-tumor antibiotics like doxorubicin, platinum agents like cisplatin, purine analogues like cytarabine, and topoisomerase inhibitors such as etoposide. What is the treatment of chemotherapy-induced mucositis? Avoidance of spicy, fires, hot, cold or acidic foods or juices or medications and beverages which contains alcohol, and the encouragement of soft, moist food and non-alcoholic beverages. Then proper hydration, nutrition and infectious surveillance must be maintained, and psychological support, all of which can significantly affect the patient's quality of life. Next complication is the chemotherapy-induced peripheral neuropathy, that is CIPN. It is a group of neuromuscular symptoms that result from nerve damage which is caused by the drug therapies used during the cancer treatment. It affects around 30 to 90% of patients, those who are getting specific neurotoxic chemotherapy drugs. The most commonly used classes of drugs causing the CIPN are taxanes and platinum-based drugs. So, chemotherapy-induced peripheral neuropathy can cause damage to the nerves which are away from the brain and spinal cord. The symptoms of CIPN include tingling or pins and needle sensation, pain, burning or numbness, sensitivity to hot or cold, difficulty with fine motor skills such as writing, buttoning and unbuttoning, and picking up small objects. Usually the symptoms are symmetrical and start at the fingers and toes and progressing towards the body. The non-pharmacologic treatment strategies for CIPN include chemotherapy dose reduction, discontinuation of offending chemotherapeutic agents, acupuncture, avoiding cold temperature or maintaining warmth by wearing gloves, socks, using heating pads, drinking warm water, running hot water over the affected area. Then physical activity like yoga, swimming, golfing, etc. can be encouraged. Then massaging the affected area. Next one is infiltration. Infiltration results when the infusion cannula becomes dislodged from the vein and the fluids are infused into surrounding tissues. Infiltration may be usually related to puncture of the distal vein wall during the IV access, puncture of the vein wall by mechanical friction, dislodgement of the catheter from the intima of the vein, then pure securement, high delivery rate and over manipulation of the site. Signs and symptoms of infiltration include increasing edema in the infusion site, feeling tightness at the site, decreases in temperature around the site, blanching, absent backflow of blood, and slow flow rate. Treatment of infiltration include discontinue the infusion, apply warm moist heat to edema, elevate the extremity, then restart the infusion at the another site, preferably at the other arm. Next complication is extravasation, that is the inappropriate or accidental leakage of intravenous drugs from the vein into the surrounding healthy tissue. Another one is vesicant chemotherapy, in that the drugs that causes blistering and other tissue injury that may be severe and can lead to tissue necrosis or tissue death. Who is at risk of increased extravasation? Patients with chronic conditions causing arterial insufficiency, patients with compromised venous or lymph drainage, patients on medication that causes skin and veins to become more fragile, like those who are receiving corticosteroids or anticoagulants, then elderly, children and sedated patients. The signs and symptoms of extravasations include the patient will be complaining about pain or burning sensation in the site, swelling proximal to or distal to the IV site, puffiness of the dependent part of the limb, then skin tightness at the venipuncture site, blanching and coolness of the skin, slow or stoop infusion, damp or wet dressing. The treatment of extravasation. Immediate discontinuation of the infusion is the first treatment of extravasation. Then cooling the site with the ice pack. We must use warm soaks for Lympha alkaloids. For persistent or progressive local symptoms, surgical consultation can be taken. And for early local debridement can reduce the extent of later injury.